COVID-19 outcomes from people being exposed to oral Cladribine is just an update. So we've now got a larger data set. So this was the data close was on November the 24th. The previous time we presented it from July 2021. So we now had 632 COVID cases. 406 were confirmed and 226 were suspected. And I think the most important message is that of those confirmed cases, there was only 60 patients that were considered serious. Most of them had recovered. Okay, there was only 4 of the 60 had not recovered, and none of the patients had been reported to require mechanical ventilation. So the proportion of patients that get severe disease is relatively small, less than 1%. Very few patients need to go to intensive care and get ventilated. And I think that's the take-home message is that compared to some of the other disease-modifying therapies, patients on Cladribine handle COVID-19 very well. Now, in the suspected cases not confirmed, there have been 4 deaths, but I mean, it's 4 deaths of 632. So we're talking about a mortality rate well below 1%, which is even lower than what you'd expect in the general population. So I think the overall message is that people on oral Cladribine who get COVID-19 seem to deal with the infection very well without any problems. And that's kind of understandable based on the immunology, because Cladribine doesn't work as a general immunosuppressive therapy. It's very selective. It leaves innate immunity intact. And even the adaptive arm, it only reduces CD4, CD8 lymphocytes, which are the ones that are important in terms of fighting viral infections, by about 40%, and it drops B cells by about 85 to 90%. So it leaves the immune system relatively intact, and so you'd expect it to be able to deal with viral infections. So overall, very reassuring about the safety of Cladribine in terms of the COVID-19 pandemic.